Thailand has begun an ambitious vaccination program in the midst of a third wave of new coronavirus infections. Millions of doses of locally produced AstraZeneca and imported Sinovac vaccines are expected to be given this month. The goal is to vaccinate about 70% of the country's more than 66 million people by the end of the year. So far, only about 2% of the population has received at least one shot of the vaccine. And joining me now from Bangkok is Frederick Spohr from the Friedrich Naumann Foundation for Freedom. Frederick was also until recently based in the region as a journalist. Frederick, the government plans to vaccinate 70% of the population by the end of the year, but does it have enough vaccines?
Well, that's indeed the big question that many people are asking here. There has been some delays in the rollout campaign of the vaccine in the recent weeks, and it seems that there's kind of a bottleneck of vaccine supply. On the other side, the government seems to have adjusted now and ordered additional supplies, not only from the local manufacturer of AstraZeneca that is producing here in Thailand, but also from other international companies like Moderna, for example, and they are also in talks with Johnson & Johnson. So they order now additional vaccines, and the goal is still reachable, I would say, but it will be difficult.
Now, critics have accused the government of complacency. They're saying it should have ordered enough vaccines last year itself. Do the critics have a point?
I think if the government would have ordered other vaccines earlier, it's quite possible that the vaccine rollout would have been faster. And it's a very difficult issue also here in Thailand. You might know that the company that is producing AstraZeneca here is owned by the king, and one very outspoken opposition politician, he pointed out to that, and he has been actually sued with the lèse majesty law. So there is not a real open debate about it, if that decision of the government has been right or not. It's a very difficult question here in Thailand.
And with that in the background, you also have a situation in which only about 2 to 3% of the population has actually received one shot of a vaccine. Why is this vaccination figure so low?
I mean, you shouldn't judge Thailand so hard. If you look at other states here in the region, you see that they also have very low rates of vaccine. Look at Vietnam, they also haven't vaccinated a lot of people. Look at Laos and other states here in the region. Maybe it is even because COVID came here or struck here much later than in Europe and in US. Thailand had the pandemic very well under control. We had rarely cases here, and it was actually a role model for other countries. It managed the crisis quite well. But this changed in the last weeks, and maybe the government also hoped that, COVID is not a big issue here. But now, unfortunately, we have another wave, which is much stronger than the waves before. And there's a risk that this wave gets out of control. So the issue became much more pressing here than it looked a couple of weeks ago.
Briefly, Frederick, which areas in Thailand are worst hit?
Bangkok is really much affected, and also the surrounding areas of Bangkok. So we have here in Bangkok around 1,000 cases, new infections every day. Thailand as a whole has about 2,000. And one big cluster are the prisons here in Thailand. So we have prisons here that have around 50% of all prisoners are infected, some even more. And this is indeed a huge problem for the government.
Frederick Spohr in Bangkok. Thank you so much for that.